So we're facing a time that we've never faced before in the history of our time ever. And so we're trying to figure out how to handle the situation that is upon us. So I use the analogy that it's like an inversion. And so all of us are asthmatics. And in the air, the quality has decreased. So there's an air of anxiety and there's an air of depression. And so we have to be aware of that. And so we have kind of a three-pronged process to address it. And the first one is having a sense of gratitude. And the reason having a sense of gratitude is because it gives us a different perspective of the world. It helps us see things in a hopeful way and in a positive way. But it's not just seeing it in a sense of gratitude, it's actually expressing gratitude. And the more we say it vocally, the more it impacts us inside not only our physical being, but also inside our mind. The second one is also to find laughter, which is actually really hard to find in this world because we can see a lot of negativity. We can actually hear a lot of horror stories. Everyone is having tribulations. And so laughter is a tough one to find. And it's not just the ha-ha, but it's the full belly laugh. But when we actually have laughter inside of our body, it communicates from the head down to the toes that all is well. And the third one is to actually find progress. And this is also a tough one when everything has been ripped out from under us. And so we find progress by sometimes it's a small to-do list. And when I say small, I mean small, like 5, not like 20. And it's accomplishing those. And it's actually not putting those in our phone and then deleting them because that doesn't have the same psychological impact. It's actually writing those out and crossing them off one by one. And the more balanced we are in progress, and when I say balanced, it's finding progress in multiple areas. So areas such as physical, which can be something that you're impacting your environment, you're impacting your body. Social, which means that you're impacting a relationship. Emotional, which means that you're increasing your own knowledge of who you are. And spiritual, and it doesn't necessarily have to be religious driven, it's just something that you're reaching higher above yourself. So even having goals in those areas and showing progress creates what we call in our world a sense of flow, which is kind of like fireworks going off in your brain, which again helps communicate that all is well. All of these things actually increase our sense of hope and that we can go through life and feel like life is good. They ease anxiety and they also ease depression. It's important to know that anxiety and depression are bedfellows. They hang out together. So they work in tandem. And so it's your body's way of self-medicating. So when your body is feeling depressed, which doesn't necessarily mean sad, it means weighed down, it means heavy, your body will use anxiety to pull up out of it to try to fix it. Well, then the problem is then when the body gets too anxious, the body will then use depression to pull it back down. And so then you get in a really vicious cycle. And with today's world, because again, and the inversion and the air quality, that even if you have completely cut yourself off from any of the news and you think, well, like COVID is not affecting me, you're still absorbing it in the air. And so think about the last time you went into any store and everyone's in a face mask. I mean, it's you, whether you think so or not, you're absorbing that anxiety that people are emitting. And it's impacting you, which means it's heightened your stress. And anxiety, we know, is a thought disorder. So the more I think, the worse I feel. So by following just these 3 simple concepts, which they're not simple, they can be quite difficult, you can actually help yourself to feel better. And the key is also, we're lucky because we've moved into spring, moving into summer. So being outside is crucial because you need the sunlight. And it's changing some of your environment. We aren't going to go back to normal, but that's okay, because a new normal is actually quite helpful. So if you find yourself not sure how to navigate and need a little extra help, there's a lot of resources that you can turn to. And a couple of those are, one is like for any of the youth, most of these should have already downloaded on their phones a Safe UT app. And the Safe UT app, even though they aren't in school, is always live. And at any point in time, they can call or text a therapist, and it's manned 24/7. And they can work through anything that they're going through. It doesn't necessarily always have to be addressing bullying or suicide. It can just be, I'm having a tough time. And for adults, that's actually a good resource too, if they don't know what to do for their youth. Because again, the therapist can point them in directions. And then for adults, obviously there's the crisis lines, there's the ERs that they can go through, but there's also therapists that you can reach out to. You don't have to wait until that you're at your wit's end. And honestly, it's better to not wait until then. And it's to reach out and seek help and say, I don't know how to handle this new world. Like, I don't know how to all of a sudden be a teacher to my kids. I don't know how all of a sudden to deal with my spouse who's in my space 24/7. I don't know how to do all of these things, or I feel like I'm losing my ever-living mind. And so any of those things are where you should reach out and ask for help. And obviously you also have your ecclesiastical leader, you have a support system that people sometimes have forgotten to say, I'm struggling, especially because we've become isolated and social distancing has made it that it's out of sight, out of mind. And those resources are still there. We've actually increased them throughout the state. And therapists have really heightened their awareness. We're assessing more than we ever have. And even though we don't necessarily have the answers and say, okay, this is how this is going to roll, this is how this is going to end, because we don't know, even on a global level, that doesn't mean that we can't give you tools to help you cope and work through these dynamics. And obviously, we're also there to be your support system to help you walk through this. You aren't meant to go through this all by yourself. You're not supposed to be a tough pioneer and work and figure this out. None of us know how to do this, but we can come together and actually figure it out together. And even as mental health professionals, that's really what our conversations are. We panel with each other and say what's working for you, what's not working for you. And we're sharing those tools, understanding that we're all in the same army, fighting the same battle. And we want to then disperse those tools to the public so that we can help them through this crisis. I realize that I can only see somebody hour by hour, and that I want to be able to give some hope and some help to those out there in some way. And I hope that by providing this message that it will do just that. It will give people some tools or even some direction to help them through this difficult time. And I hope that you are able to have the courage and the strength to reach out and get that help for you or your loved ones. Thanks.